investigation. In health facilities, like in other work facilities, accidents and incidents are likely to occur. And when they occur, it is necessary that such events be well investigated in order to guard against a repeat in the future. Now, like was said, you can't help guard against the happenings of accidents or incidents. No matter how well prepared you are, certain times this will happen. And when it happens, there must be a thorough investigation of the events so that after that scenario had happened, in the future, the likelihood of it repeating itself again would not be there, because proper investigation have been carried out and lessons have been learned from the accidents and incidents. So, but before we go deep into this, let's define some terminologies, especially accident and incident. Accident is an unintended occurrence that happens in the course of work with the possibility of causing harm to the employee. It is unintended, but it happened, and it has the possibility of, harming the employee. Incident, on the other hand, is an unplanned event that has the potential of causing injury or ill health, but never does. It happens, is unplanned, it has the capacity of causing injury, but it eventually did not. It's just like somebody was walking by and didn't know that there was water on the floor, and he slipped. He was supposed to land with his head on the ground, but eventually he was able to gather himself. He didn't fall to the ground. That is an incident. But if he had eventually slipped and fallen and then had impacted his head on the ground and his skull was opened, that is an accident. Did you get that now? So, another important subject of note is dangerous occurrences. Examples of such occurrences in healthcare facilities can be gas leaks, exposure or explosions of an electrical appliance, etc. There are a lot of dangerous occurrences that could happen. Now, let's see some of the mostly reported healthcare accidents. We have slips, trips, and falls, shock, fright, and violence. Those are some of the most important events that happens in healthcare facilities. Another one is manual handling. Now, what is manual handling? This involves the moving and handling of key aspects of the day-to-day operations of most employees. See, in health facilities, manual handling includes the moving of equipments, laundry, catering, supplies, waste, assisting residents in moving, etc. If these are not done as safely as possible, health and safety of those involved might be compromised. Let's say, for example, if you're a medical lab scientist and you are supposed to carry your test tubes that have some contaminants in them, of course, test tubes you've used to work and all that, and you know that those test tubes contain very dangerous organisms and all that, and you're supposed to move them from point A to point B, and it happens that eventually you sleep and those test tubes happen to pour you on your body, splashes all over your face and all that. That is dangerous, you know. That is dangerous. That is an accident that can happen in manual handling. You being, you carrying that or those test tubes from A to B is manual handling, and because you didn't take care of yourself as well as possible, you have become exposed to a grave danger. Or let's say you're trying to, there are a lot of examples that abound. So these are examples of certain things that can happen, certain accidents that can happen in a healthcare facility. Now, need for reporting and the investigation of accidents. Reporting and investigation of accidents helps to identify what went wrong, so actions can be taken to correct or correct it, hence preventing the like of such happening again. The purpose of investigation isn't to find someone to blame, but to forestall a repeat in the future. It's as clear as that. After a proper investigation had been conducted, any inappropriate conduct can be well addressed. Also, investigations must be carried out immediately after the event, when it is still fresh in the minds of eyewitnesses, not afterwards, not after so many probably days had gone or weeks. Immediately, investigations must start immediately the event happens. Now let's see some of the causes of accidents and incidents in healthcare facilities. They actually divide into three major contributory factors. And number one is immediate cause. This includes the tool of work, item, or employee-employer behavior that caused the accident or incident. The kind of material that is being used for work. Is it of the highest standard? Is it of the highest quality? The item used, are they of the highest quality? The employee's behavior, did it play a role in bringing about that accident or incident? What was the behavior, the part that the employer's behavior played? When he was supposed to buy a quality material, did he buy a quality material or substandard material? Did that play a role? Number two, underlying causes. This more or less concerns the environmental factors, work conditions, or unsafe acts that led to the behavior that brought about the accident or incident. What this is talking about is this. There are some people who work under certain environmental factors that are not good for their health, and because of that, they malfunction. Or there are certain equipments that are not meant for certain environmental conditions that are used in those conditions, and because of that, they malfunction and they bring about certain accidents, explosions, or cases as the cases may be. Work condition. Maybe this person has been placed under serious pressure. This person has been working long hours, no rest, nothing. And then because of that, things can happen. A medical doctor had been working long hours and still he's expected to continue, and then he or she goes ahead and does something to a patient that brings about an accident or an incident. All these are underlying causes. Number three, root cause. This refers to the existing basic faults within the work process, work environment, or from within the executives, from whence accidents or incidents emerge. Is there within the work process that have been put in place. It doesn't matter who is doing what, no matter who it is that comes in there, because of the process, it will also happen. That is another cause of what can bring about accident and incidents.